There was a lot of death. Every single day, I knew of someone that had passed from COVID. And that does something to you because that's your family, that's your community. Hi, Grandma. In a way, you almost feel self-defeated. Like, how do I help?
That time I was okay. Next day I'm okay. Yesterday evening, he really hit me. It was really hurting on the side. Hurt.
Mentally and emotionally, it definitely impacted me. Sorry. No, I was just thinking about my uncle who passed, and I grew up with him. He was closer to my age, although he was my dad's youngest brother, but we grew up together. And it hurts, for sure. The Navajo Nation is the size of West Virginia, but yet there's only 13 grocery stores that lie within the reservation. How do you tell a community in the United States that has no running water or electricity to wash their hands? Do they have the financial means to get gas to go to a hospital or clinic? Housing is overcrowded within and among Navajo households. And then you talk about pre-existing health conditions, chronic diseases, also other infectious diseases. And in combination with the outbreak of COVID, it really hit our community extremely hard. My name is Dr. Crystal Lee. First and foremost, I'm a scientist/academic. Both my maternal and my paternal grandfathers were Navajo medicine men. I was 8 years old and in a ceremony watching my grandpa pray for someone. And I remember sitting there in the ceremony and I thought, wow, that's what I want to do with my life. I want to become a doctor and I want to help my people. At the institutions I have been at, I was usually the first Native to graduate. I wanted to see how I can integrate policy with all this health and science because health policy is such a huge factor on making change. I actually made a recommendation at the United Nations Permanent Forum on Indigenous Issues back in 2018. One of my primary recommendations was they improve international health policies in the event if a pandemic occurred, acknowledging that Indigenous populations globally would be the most adversely impacted. Now you bring us to 2020 when COVID hit the Navajo Nation. My hypothesis was absolutely correct. Historical trauma in our communities has been such a deep and heavy issue for us Native Americans, Alaska Natives, Indigenous people of this land. It was very purposeful to expose us to infectious diseases as a way to commit genocide. And that purposeful act, along with multiple acts, still impacts our health and well-being.
$400-something dollars a person. It's not enough to provide services in terms of food.
For example, when the first round of federal funding came out to assist states to combat COVID, tribes were not included in the first round of federal funding at all.
I hoping I get a different answer, but I talked with him and he said the monies are pretty well spoken.
A big reason why our points of care and our Indian health service system is so substandard is because we get discretionary funds at the congressional level. We are the last to get funded and the first to get cut. That was a huge layer of why it took our tribal communities longer time to react, because we literally did not have the fiscal resources. Part of my academic training is infectious disease and preventative medicine. And when the virus first came out, I understood how the virus was most likely an airborne virus. My nonprofit, United Natives, was the one who spearheaded all of the COVID-19 initial efforts in 2020. And with that, I made some culturally responsive recommendations. For example, as Natives, we burn sage, cedar, and/or sweetgrass. There has been scientific knowledge that if you burn any one of those, sage, sweetgrass, or cedar, that what happens is the smoke weighs down the particles in the air and it falls to the ground. It doesn't kill the virus, but it weighs it down, so it's no longer lingering as airborne. So part of my recommendation to our Native community was, if you had someone in the household that's coughing that you think might have contracted COVID, let's resort back to some cultural preventative practices. Again, there was no scientific knowledge that it worked with COVID, but at least we could try our best to implement some prevention strategies that were cultural based. In addition to that, we delivered masks, Lysol products, in total to about 70 different tribal communities. We partnered with another company temporarily to quarantine Native people. We would pick them up and we secured an entire hotel with over 100 rooms. In March, April, and May, our hotel rooms were completely occupied by people who were COVID positive. Out of the thousands of people we quarantined, only one passed from COVID. And as a result of our quarantine phase, a huge observation was our community members verbalizing that my 14-day quarantine phase is done, I'm COVID negative, but yet I don't have a home to go back to. I don't have a job, I don't have food. I'm a female that's a victim of domestic violence. I don't want to go back home because I'm getting abused, myself and my children are not safe. There was a huge increase in substance abuse, a huge increase in domestic violence, especially among our Native women. And we knew that we had to come up with a plan very quickly. So we ended up turning that hotel into a mental behavioral health facility because of the need. As a result, I started my own company, again, out of need, which is called Indigenous Health.
And we do everything from medical health services to mental behavioral health.
We opened our doors January 10th of 2022, and Indigenous Health started as a mental behavioral health company to address the gap in need. We have Native American clinicians on our team, and we have evolved into a nationwide company now providing services for the urban natives in Baltimore, Maryland, Washington, D.C., Boston, Massachusetts. We will soon be in New York City, in Chicago, Illinois, in Los Angeles. And we find that these efforts really help our Native community, especially those that are dealing with mental behavioral health issues. And I want to bridge the gap of access to care and quality of care, but not only that, I want to help with bringing culture and our indigenous ways of health and healing and combine it with Western medicine to help our people. What we're doing now, peer support. You know, you excel this long in this program. Now you feel that you're able to help your other peers who are incoming to the program, maybe the newer ones.
I have so many ideas, so many things that I want to do for my people, for myself, for my kid. I want to open a business. I want to do cosmetology school. I want to work here. I want to, you know, like I want to learn to pray.
Native Americans, Alaska Native people do not have health equity. And I do not believe that we will achieve it in my lifetime. However, we can make strides to get there. I had that vision at 8 years old. And for me to be able to live my vision and live my dream, to honor what my grandparents had prayed for, what my ancestors survived, for me to be here in 2022 as a Navajo woman, as a doctor, and to truly give back and help my community. I just really hope my ancestors are proud. I can think of my grandpa and my grandma's looking down and saying, this is what we prayed for. And we're really proud of her.